When performing CPR on a child, what is the ideal hand placement? A. 2 hands on the lower half of the sternum. B. 1 hand or 2 depending on the size of the child. C. Fingers below the nipple line. D. 1 hand on each side of the chest. Answer: B. Use 1 or 2 hands based on the child's size to deliver compressions effectively on the lower half of the sternum. How soon should defibrillation be performed for a victim of sudden cardiac arrest? A. Within 8 minutes. B. Within 5 minutes. C. Within 2 minutes. D. Within 10 minutes. Answer: C. Early defibrillation within 2 minutes greatly increases survival chances in cardiac arrest. What is the compression-to-breath ratio for 2 rescuer adult CPR? A. 15:2. B. 5:1. C. 30:2. D. 10:1. Answer: C. For adult CPR, regardless of number of rescuers, the ratio remains 30 compressions to 2 breaths. What is the correct sequence for BLS according to AHA? A. ABC, airway, breathing, circulation. B. CAB, circulation, airway, breathing. C. CBA, circulation, breathing, airway. D. BCA, breathing, circulation, airway. Answer: B. The correct BLS sequence is CAB, starting with chest compressions. If an adult has a pulse but is not breathing, what should you do? A. Start CPR. B. Deliver rescue breaths every 5 to 6 seconds. C. Apply AED. D. Perform abdominal thrusts. Answer: B. If a pulse is present but no breathing, give 1 breath every 5 to 6 seconds. What is the maximum time you should take to check for breathing and pulse? A. 20 seconds. B. 15 seconds. C. 10 seconds. D. 5 seconds. Answer: C. Limit checking for breathing and pulse to no more than 10 seconds to avoid delay. Which pulse is checked in an unresponsive adult? A. Radial. B. Femoral. C. Carotid. D. Brachial. Answer: C. The carotid pulse is preferred when checking for circulation in an unresponsive adult. Which pulse is checked in an infant during BLS? A. Carotid. B. Brachial. C. Femoral. D. Radial. Answer: B. For infants, check the brachial pulse on the inside of the upper arm. When should you activate the emergency response system for an adult collapse? A. After 2 minutes of CPR. B. Immediately. C. After applying AED. D. After checking pulse. Answer: B. For adults, activate emergency response immediately upon identifying unresponsiveness. Why is minimizing pauses in chest compressions important? A. It helps with breathing. B. It keeps the rescuer's rhythm steady. C. It maintains blood flow. D. It allows AED to analyze. Answer: C. Minimizing interruptions helps maintain circulation and improve survival outcomes. What is the ideal rate for rescue breaths in infants and children with a pulse? A. 1 breath every 2 seconds. B. 1 breath every 6 to 8 seconds. C. 1 breath every 3 to 5 seconds. D. 2 breaths every 10 seconds. Answer: C. For infants and children with a pulse but no breathing, deliver 1 breath every 3 to 5 seconds. What is the most common cause of cardiac arrest in infants and children? A. Respiratory failure. B. Heart attack. C. Stroke. D. Head trauma. Answer A. Pediatric cardiac arrests are often caused by respiratory problems rather than cardiac issues. What should you do if a patient has a hairy chest and you must use AED pads? A. Shave the area or use a second set of pads to wax it. B. Place the pads anyway. C. Shock without shaving. D. Skip AED. Answer A. If the hair prevents good pad contact, shave or use a second set of pads to remove the hair quickly. What is the correct ventilation technique with an advanced airway in place? A. 1 breath every 3 to 5 seconds with compressions. B. 2 breaths every 30 compressions. C. Continuous compressions and 1 breath every 6 seconds. D. Pause for breaths. Answer C. When an advanced airway is present, give 1 breath every 6 seconds with continuous compressions. When should you not perform a blind finger sweep? A. When the object is visible. B. When the victim is unconscious. C. When you cannot see the object. D. When performing CPR. Answer C. Never perform a blind finger sweep, especially in children and infants. It can push the object deeper. What defines high-quality CPR? A. Slow compressions and deep breaths. B. Fast compressions, minimal recoil. C. Adequate rate, depth, full recoil, and minimal interruptions. D. Shallow compressions with fast rhythm. Answer C. High-quality CPR involves 100 to 120 compressions per minute, 2-inch depth, full chest recoil, and minimal pauses. What is the first step in the BLS assessment? A. Start compressions. B. Attach AED. C. Check responsiveness. D. Deliver a shock. Answer C. Always begin by checking if the victim is responsive before proceeding. What should rescuers avoid during compressions? A. Leaning on the chest between compressions. B. Pausing for AED use. C. Performing mouth-to-mouth. D. Switching roles. Answer A. Leaning on the chest prevents full recoil and reduces blood return to the heart. When using a bag mask device, how many rescuers are recommended? A. 1. B. 2. C. 3. D. 4. Answer B. 2 rescuers are optimal, one seals the mask and the other squeezes the bag. How can you improve CPR performance in a team setting? A. Use minimal communication. B. Let one person lead and assign roles. C. Rotate once per hour. D. Avoid feedback devices. Answer B. A designated team leader helps coordinate tasks, ensures communication, and improves performance. Why is early CPR important in the chain of survival? A. It slows heart rate. B. It replaces AED. C. It buys time until defibrillation. D. It prevents seizures. Answer C. Early CPR maintains blood flow to vital organs until defibrillation can restore normal rhythm. In 2 rescuer CPR, how should duties be split? A. 1 performs compressions, 1 provides breaths. B. Both provide compressions. C. Both perform breaths. D. 1 watches the scene. Answer A. 1 rescuer does compressions while the other manages ventilation for efficiency. Why is it important to avoid excessive ventilation? A. It wastes oxygen. B. It can reduce blood return to the heart. C. It speeds up heart rhythm. D. It keeps the victim calm. Answer B. Excessive ventilation increases intrathoracic pressure and reduces cardiac output. Which of the following best describes the purpose of high-performance team dynamics in CPR? A. To save equipment. B. To reduce AED use. C. To improve communication and patient outcomes. D. To speed up rescue breaths. Answer: C. Teamwork, communication, and defined roles improve efficiency and outcomes. What should you do after delivering a shock with an AED? A. Wait for the AED to recharge. B. Begin CPR immediately. C. Recheck the pulse. D. Turn off the AED. Answer: B. After a shock, immediately resume CPR without delay for 2 minutes.